Hi, everybody. My name is Neil Seidman, and I'm co-chair of the Public Education Committee for ADAA, the Anxiety and Depression Association of America. Welcome to our webinar, Starting Treatment for PTSD, How DBT, Dialectical Behavior Therapy, can help. And our presenter is Laura Efland. Thank you so much, Laura, for joining us.
Thank you so much. It's wonderful to be here.
So these webinars are presented by ADAA. Okay, so let's get started. I'm really happy to introduce our presenter. Laura Efland is a licensed clinical social worker. She received her master's degree in social work at Loyola University of Chicago. She specializes with traumatic stress disorders, with depression, anxiety, OCD, and eating disorders. Ms. Efland focuses on evidence-based approaches, which includes what we're going to talk about today, dialectical behavior therapy, and also cognitive behavior therapy, prolonged exposure therapy, and mindfulness meditation. Just a breadth of expertise. So now let me turn things over to Laura.
So we're going to start with chapter 1. And something I just wanted to start with is that studies have actually shown that those who struggle with post-traumatic stress disorder, they don't actually, on average, do not actually seek treatment 8 to 10 years post the event. So if you can imagine how hard that must be. And so many times, so I've done a lot of trainings, I've done a lot of presentations on post-traumatic stress disorder and DBT. And there are people in the audience that will come up to us and be like, that is me. That was me. You know, or I have a friend just like that, or a family member. They didn't know what was going on for them. So just please know that it's not unusual to be going through post-traumatic stress disorder and to not know what it is, or to not know that you would actually benefit from treatment. So I wanted to start with just defining trauma. And really, I feel like the best individual to define trauma is the person who has experienced it. And so those that have gone through, who have gone through trauma, define it as an event that threatened their sense of safety and changed their relationship to themselves, other people, and the world around them. And they have lost this sense of safety. And so what has happened is this really stressful life experience has caused them to become overwhelmed, or what Neil has described as underwhelmed, and they have lost their ability to cope and be in the here and the now. So being in the present moment is incredibly hard to do because your brain and your body are telling you that there is danger around any corner. And so life feels very threatening. And that's why it starts to feel this, the stress increases over time, which is that post-traumatic stress.
This is a really helpful definition of trauma because we might use that word in different ways. Mm-hmm. And as I look at, this is a good slide if you're watching and you wanted to pause it and take some time with it. It's really different than stress. Stress might come and go and, you know, in different varieties throughout the day. But this is like a particular event that really might have changed my life, and with that, you know, threatening, undermining my sense of safety,
right,
and having that overwhelm. Really, really helpful. Thank you.
Yeah. So here are just some, kind of facts. When looking at the prevalence of trauma, I think that's the other thing that, a lot of times people don't realize what, that trauma does occur. And also those that are seeking treatment, the likelihood that they have gone through a traumatic event is that much greater. And so just in the general public, what we have, come to find is approximately 7 to 12% of adults in the US will develop post-traumatic stress disorder at some point in their life.
So this is a
8%.
very, very common condition. Now, I have a question, Laura.
Yes.
If I've experienced one of these traumas that really, affected my sense of safety, does that mean that I'm going to get PTSD?
That is such a good question. No, that is not actually going, just because there has been a traumatic event does not cause post-traumatic stress disorder. So it is one of the major triggers that leads to post-traumatic stress disorder. However, there are others that can go through the same events, similar to what is listed below, traumatic events most likely to cause PTSD, and they do not develop PTSD.
Right. So coming back to this slide, now this slide is talking about people that do develop PT, not just people that have traumatic experiences, but people now that develop PTSD.
Correct.
And this
Most
is
likely.
really, really something that somewhere around 10% at some point in their lives are going to develop this condition that we're talking about.
Right. Then breaking it down to the types of trauma that you're kind of going through can also be one of those risk factors. And so just kind of looking at and breaking down, it can also be how common it is. So the prevalence of this type of trauma for that particular individual or group of individuals, and what can tend to happen within that. And I also, I do want to be thoughtful and just kind of state, I realize that, this is only kind of categorizing women versus men, and that there's a lot of other types of traumas and different groups that go through traumas. And so I know that is not included in this particular slide. What are the symptoms of PTSD? So DSM-5 really kind of is our diagnostic manual, looking at, where are we today and what we kind of see as diagnosable disorders and the characteristics that go within this. And there has to be, each of these are categories, and then you have to have a certain number of traits within each of these categories in order to then be diagnosed with post-traumatic stress disorder. So one is re-experiencing the trauma. So you are having experiences post-trauma that, are bringing it back up for you. Flashbacks, intrusive thinking, nightmares. You have hypervigilance, so your body is reacting as though it's going through the traumatic event, dissociation, things like that. Avoidance of trauma reminders. So that actually means that you are, kind of intentionally not doing or going or seeing people or places or things because of the fear that it would cause this huge amount of distress for you. Negative alterations in cognitions and mood, really getting stuck in negative thinking.
Cognitions, is that talking about negative thinking?
Yes. So cognitions is all about your thought. And then the mood is your feeling state. So it's a collection of emotions over a longer period of time, and what is called a feeling state or mood. And so a cognition, this is where we start to kind of look at your thoughts, and you're having a lot more kind of hopelessness or helplessness type of thoughts. Nothing's ever going to be better. If you have a lot of thoughts of like, it's my fault, I'm bad, this wouldn't have happened to me if I were a better person, if I were a stronger person, and then starting to have changes in your mood as well, related to kind of all these different thoughts and interpretations. And that is then having lots of anxiety, having depression, having, feelings of numbness, just not even actually knowing what you're feeling at all, or losing sense of time. So you actually lose pockets of time and you don't know what happened. That's where we're starting to kind of get into more of like the somatic shifts that can happen for you, like dissociation or depersonalization. And increased arousal and reactivity. That is where you're having a physical sensation. You're having lots of physical sensations. You are starting to experience, a shift in your internal and then also how you experience the external. So that's similar to you, like going to crowded areas. Like a lot of times individuals with PTSD do not like to sit with their back to a door. So they have a strong increased arousal when walking into a room, or because we do lots of groups. And so they sit around the room, and the idea of not being able to sit facing the door, they think about it even before they come to the group. They have a strong anxiety. They start to be concerned and, kind of hyper focus on their safety and whether or not they're going to be able to control for that. So this is where your mind is starting to kind of take over. And it's almost like PTSD kind of puts blinders on, where you are so focused on your safety because, once again, the world feels very dangerous.
So when you use the term arousal,
yeah,
I think of being on edge. Would that be part of that experience?
It can definitely feel on edge. Yeah. It can feel like you just can't sit still. Mm-hmm. It can just feel like, a huge no, that, somebody asks you to do something. No, like you don't even necessarily have a feeling of being on edge all the time. It can just be this very strong sensation or this very strong sense, and then a want to either completely avoid the thing that you're afraid of, because it's such a distressing feeling. You just don't want to feel that distress anymore. It's too much.
Really, really helpful.
Yeah. Common reactions to trauma. So here we have 3 different categories, which is emotional experiencing, behavioral regulation, and interpersonal connection. And this, I think, really kind of sums up what we've been, kind of talking about when it comes to arousal, reactivity, the way our mood and our behavior is influenced by PTSD. And so we have, within emotional experiencing, we have emotional reactivity and emotional avoidance. So much to that hyperarousal, anxious, on edge, that is that emotional reactivity. So that would be on the more activated side of emotional experiencing versus emotional avoidance. And this would be the underactivated. So this individual is actually avoiding, maybe even coming across as incredibly flat, disconnected, no longer having interests or, wants in the world. So they have actually, kind of moved away from trying. So their way of managing this reactivity or this emotional heightened experience is to just try to remove it completely and just not connect to it.
So these 2 ends of the spectrum here are both aspects of PTSD.
Correct.
And I might experience like just a very high emotional reactivity. Any little thing might get me startled or anxious or angry or upset or depressed. And then on the other hand, another symptom of PTSD could be that I just don't feel anything. Yeah. I just could just be under experiencing.
Yeah, right. And we can oscillate between the two. But a lot of times with PTSD, we tend to, because it's a disorder, we tend to experience extremes. So, and that's what we're doing within the treatment is we're trying to bring it back to the balance. It's not as though we're trying to get rid of this emotional experiencing, and we're just trying not to make it be such wide swings. Mm-hmm. And behavioral regulation, we have similar impulsive behavior. So not thinking, just quickly acting, sometimes even putting ourselves in unsafe situations because of that. And then behavioral or that compulsive behavior. Now that is where we are being very rigid. We're being very over-controlled in what we're doing and how we're doing it. We're removing anything that could potentially be unsafe whatsoever. And, that's where we're actually kind of going to the other side. We're overprotecting.
Okay.
And then interpersonal connection. So we have excessive intimacy is more of this under-controlled behavior versus excessive independence. So when we're in our relationships, excessive intimacy is where our boundaries with individuals, both emotional and in an intimate way, both, sexually, emotionally, we are not necessarily, we're not using boundaries to help us manage to build really authentic, long-lasting, intimacy with an individual. And instead, the excessive intimacy, actually Brene Brown says this so well, is hot-wired intimacy. We're looking for the quick
hot wire.
version.
That's a good metaphor.
So such a great metaphor. She's so good at those. And so excessive intimacy is like you have a higher likelihood of doing hot wired intimacy, where you're doing things, so like you're oversharing, you're over, kind of giving of your time. You may be, kind of having a really emotionally kind of connected experience with someone, and you just met them. And so then that leads to a sexual intimacy because there was that emotional intimacy in that moment. And that happens more often than not. And so that's where we're starting to we're moving into intimacy that does not necessarily have a lot of effective tools within it, which is meaning we are trying to work on things to build a long-term gain. Instead, we're looking for short-term gratification. Where then excessive independence is we are actually only looking at, kind of ensuring that we have long-term safety. And so that excessive independence is we're not, it's kind of similar to the compulsive behavior examples that I was sharing with you. We are not sharing anything about ourselves. We do not get close to people. We do not go out with people we don't know well. So we end up only kind of going out with long-time friends or family members or things like that we feel like we know 100% for sure that they are a safe individual, or we may not be going out with anyone at all. So that's where we really withdrawn socially.
Well, this was a wonderful introduction to exploring what is PTSD, and this will wind up chapter 1. And we look forward to continuing in a moment with chapter 2.